Okay.
Hi, Cliff. Thanks for being here with us today. And by us,
Thank
I
you.
mean the virtual audience who'll be viewing this interview on the APTA Oregon site once it's posted. So nice to meet you.
Thank you. Thank you. It's a pleasure to be here, man. I appreciate the opportunity.
Great. So today I'm going to be asking you a few questions around your area of expertise and knowledge and your PTA perspective in the clinic. But before we get started, I was wondering if there's anything else you would like us to know about you, as in your certifications and areas of practice.
Well, I've been practicing really for the greater part of my career. I've worked in outpatient orthopedics. When I first graduated from Mount Hood back in 1999, I spent a little bit of time working in crossing over between acute care, but the majority of my time has been in orthopedics outpatient. And over the years, I've had an opportunity to do some extended training and have been certified, most recently in ASTEM. Uh, and the physical therapist one of the physical therapists that I work with is a manual therapist, and so he's been doing ASTEM for years. So I've been able to go through that. Also, recently went through Evidence in Motion's PTA certification with a focus on orthopedics. So I was able to go through that program and finish. Have gone through an extended number of kinesiotaping classes and was certified through the Kinesiotaping Association for a number of years. And then I'm also a certified personal trainer and have gone through that process, gone through classes to become certified in senior fitness and corrective exercise. And so those, even though it's not necessarily under the physical therapy scope, those tools and the education I got there, I've been able to bring into clinic as well. So.
Awesome. Well, so before we get any further, I have to say I skipped a step. So I forgot to introduce myself, even though we met prior to recording this. So my name is Rachel Stokely, and I am a second year PTA student, also from Mount Hood Community College. Represent. Thank you. I'm here today with our guest, Cliff Stanford, for this edition of the 2021 Year in History interview as part of the APTA Oregon Centennial celebration. So I have already formally introduced our guest today, Cliff Stanford. He's a PTA and he practices at Proactive Physical Therapy Specialist, East Vancouver. Did I get that right?
That's correct. Yeah.
Great. Okay. So I was kind of interested in some of your credentials because I also have an ACSM and personal training with a long history of that in my background, and also some of the NASM and CES and senior fitness specialty too, because I have a love for gerontology and working with the older patient, and I have an interest in possibly working in SNF in the future. Mm-hmm. So I was kind of curious about how maybe those that past history, a background in fitness and health and fitness kind of help you in your experience, and like how do you use that in your practice?
Well, I think early in my career, especially while I was going through PT assistant school, I spent time working in a skilled nursing facility. And it gave me a greater awareness of as we get older, the limitations that come in great part from almost a lack of knowledge, that just because I'm getting older, just because maybe I'm not in the workforce anymore, doesn't mean that I can't keep moving. And I learned ways to continue to educate people on the benefits of fitness, but how implementing these techniques that oftentimes we'll use with younger populations, that sometimes becomes a bit of a fear base for people as they get older. Oh, I can't do that anymore because I'm older. Learning the language to use to encourage people to continue to take on fitness as a part of their daily routine, but also to help identify some risks that may be associated. And as working in the field of physical therapy, I think these are things that are more forefront in our minds because we're looking for these things oftentimes in clinic. But if we're working with an individual who does go to a community center or does have a gym membership, things that we can teach them to look out for when they're out in that setting, So just a way to reinforce a lot of the things that we know in PT, but how do we, again, use that language that will carry over really easily to folk when they're not in the clinic with us?
Yeah, I like that. Okay. So I have to say, in preparing for our meeting today, I did look into your bio, not stalking or anything. I just wanted, I like to be prepared. But
Yeah.
you did mention the ASTEM certification. And I
Yeah.
have to say, I've never heard of that before, but I did read that it's kind of an alternative or similar to the Graston method. Is that correct?
Yeah, there's a relationship between Graston and ASTEM in terms of how they've been used within our profession and similarly used in the chiropractic profession. And my understanding is one of the greatest um, benefits, I guess it's one of the greatest differences, I guess, is how it's implemented. And it's real, ASTEM has really been adopted by the physical therapy community, where to a greater extent, Graston has been adopted by the chiropractic community. So almost sisters in terms of, or relations in terms of what the tools, of using the tools and why you use the tools for improving myofascial mobility, for improving general mobility, and then implementing some follow-up therapeutic exercise, stretching, things that are probably we see more in our profession in terms of physical therapy versus chiropractic care.
Okay.
But a lot of it's based on older Eastern medicine. When we think about um, using tools to assist with manual therapy, tools greater than our hands. So when we look at techniques like gua sha, that initially folk used bone or stone or other materials as an instrument, um, and ASTEM has developed a particular number set of, in this case, 3 set of tools that are great for really saving our hands when we're doing a lot of the manual therapy that we're doing. So again, using these tools to work on improving fascial mobility, but then following that up with movement therapy, flexibility work, strength work, general movement.
Nice. I'm definitely going to look into that
Yeah,
further.
it's
Thank
cool
you.
stuff. Really cool
Okay.
stuff.
So, changing focus just a little bit, I am curious about how your clinic is managing patient care regarding COVID scheduling and treatment of patients right now.
You know, we've really worked to, and we've been really blessed because we moved into a newer space probably a few months after COVID really took hold of our community, and the space that we're in now is quite a bit bigger. And so the idea of thinking about social distancing in the clinic is so much easier when you're in a bigger space. So our exercise equipment is much more spread out. Our treatment tables are much more spread out. We have more
Nice.
treatment rooms where we can bring people in to isolate during those treatments. And then we're following a lot of the community guidelines. Patients are required to wear masks when they come in. We ensure that we have hand sanitizer throughout the gym. And it sounds silly to say this, but we have a greater focus of using our tech staff to ensure that when patients are using equipment, immediately it's wiped down and cleaned before the next patient arrives. Temperatures are checked when patients check in and sign the sign-in sheet. Our front office staff does a great job of making sure all of the temperatures are checked. And then just increased communication, asking patients how they're feeling. In conversation during treatments, patients oftentimes share how the family is doing. And if they mention, oh yeah, so-and-so was diagnosed with COVID. Oh, well, when's the last time you saw so-and-so? And, just
Mm,
just more
yeah.
communication.
Yeah.
Those are some of the big things that we've done to make sure that everyone is safe.
Okay. So, you already told us about some of your background in orthopedics and working in SNF. Are these different than in areas as a student you thought you'd be working in, or did you think you would go in a different direction?
I think I always felt like I wanted to do outpatient orthopedics. Again, I was working in that setting as a student and dug it and thought that I'm so glad I had that exposure. But I think I knew I always wanted to work in outpatient orthopedics. Just I felt like it was just a better fit for me. So I wanted to be open-minded, going into school, especially having the opportunity to be a student and work in different settings and really um, assess how that felt, what that fit felt like. But as I was going through school, was I think that really confirmed my thought that yeah, outpatient orthopedics is where I'd like to spend my career.
Nice.
Yeah.
So I'd like to inquire about working alongside a PT professional, and
Mhm.
what qualities do you believe make a strong PTA team?
Um, to me, the biggest thing is just really good, healthy communication for a lot of reasons. One, when we think about our roles as PT assistants, and my philosophy has always been, I really want to just be that extension of the PT. So I need to get into the PT's head to understand how they think, how they process information. I think we get a lot of that from reading a chart, reading an evaluation, reading a treatment plan of care. But I think that takes us so far because it's to me, it's really, really valuable that when I see that patient for the first time, um, they don't really see a significant difference in terms of their care from what they're used to getting with the physical therapist, especially if they've seen the PT for a couple of visits. I want it to be a very, very smooth transition. And so having really good communication with the PT, I think is vital for that. So that even though the PT may have written, this is my plan of care, these are the goals that I have, sometimes during that process, that may change a little bit. And it's not always easy to capture that in word in the patient chart. And then communicating with the PT is important because as I'm working with the patient, I want to be sure that I have that PT's ear to say, hey, during treatment today, XYZ happened. Or, hey, this is how they're doing in terms of meeting that goal. They've met it, or they're really having difficulty with it. So the PT knows that they have really good confidence and understanding of when I go to do that next recheck, this is kind of where we're at. So I think that's the primary thing. And then as we go through the process of continuing our education for our license, really understanding what the PT's goal are for, big picture. As I'm taking Con Ed classes and courses, which courses should I take? What really makes sense for the setting that I'm working in, for the PTs that I'm working under? Using ASTEM as the example. Our clinic director has used ASTEM for years. And so as I'm looking at Con Ed courses, it really made sense to follow that path so that again, as I'm working with his patients, it's just a seamless transition. Oh yeah, he uses those tools. I understand it. We've talked about it. So I think communication is key. Good communication is key.
Yeah. So you pretty much answered my next question, which was how does that teamwork benefit the patient and patient care? So I'm hearing communication between you and the physical therapist, which of course naturally is important. And then also continued education that is in line with where you work so that you can continue to benefit the patient that way and having a seamless transition between care.
Absolutely, absolutely. And I think in my experience, it also works both ways because I've been practicing long enough now that I've had a chance to work with a number of physical therapists, some PTs who are newer graduates, and so they may not have that same depth of experience yet. And if I can be a good communicator with the PTs I'm working under, it then allows me to share different ideas and different concepts, maybe that they just haven't been exposed to yet in terms of that extended conversation or extended education. So as we
Mhm.
talked about, all of the coursework that we get going through the personal training education, how I've been able to pull that in and see the benefit of how we treat our patients in PT to be able to share those concepts in the other direction, or even other PT continuing education classes that I've taken to be able to share that education, so that if I'm working with a patient and think, hey, this is something that I think this patient may benefit from, to be able to communicate that back to the PT. And the more we communicate, the more they understand my knowledge base, my understanding, and then that just builds trust. And so then the PT goes, oh yeah, you know what you're doing. Go ahead, handle that.
Yeah, I like it. It's kind of like what we've been taught in school that we're always, there's always new things and we're learning things and it's new and fresh. So when we take that to our clinical rotations, we're introducing these new ideas and concepts to our PTA, our clinical instructors. And it's like, hey, we can
Mhm.
actually teach you something sometimes. So that's neat when that happens.
Yeah. And we know, I mean, within our profession, things are constantly changing. So, again, I've been blessed to be out for a number of years. And so when I have folk who come in and there are these new concepts and these new ideas, and it does nothing but help make me a better clinician, which then in turn helps our patients.
Yeah. So what do you think are the most important things that PT should know about PTAs in general?
I think, really just what we learn. I've learned that in many PT programs, there is the understanding that there are physical therapist assistants out there in the workforce that you may have an opportunity to work with. And oftentimes PTs in their formal education kind of get a very small snapshot of what our base of education is, but that's kind of it. And so I think making sure that PTs know what we learn in school, but then also educating and reminding PTs that a lot of the post formal education that we get in terms of continuing education, oftentimes we have the opportunity to sit in those same classrooms with PTs. And so our post formal education is very, very similar to physical therapists. That our education level and our life or our work experience is a bit more than a PT tech who will get that on the job training. Our knowledge base is more in depth, and we have learned and we have the capacity to identify and progress patients through their treatment plan of care, um, uh, in line with, yet independently, to create more space for PTs to do their assessments and progressions.
Great. So any last words you'd like to share with us before we end our interview?
Oh, man, just that it's such a joy and an honor and a blessing to be able to work in a profession where we can impact people so greatly. And the value of team is huge. Um, aside from ensuring that we have an understanding of how we work together as clinicians, to educate our community of how we work together as clinicians is huge. When that patient walks in and they see the A behind my name, that patient knows, again, we're just an extension of that individual that you saw in your very
Yeah.
first visit. That it is truly a team, and we're all working together, speaking the same language to help get you back to work or get you back on the athletic field or whatever the case may be. Um, and so just putting that forth to everyone involved, including our payers,
Yeah.
that we're all working together for the same common goal. And just really honored to have worked in the profession that is as long as I have. That is just, it's so great. It's so valuable. It's so beautiful, and it's cool to see. We're a century in and still making an impact on the world.
Yeah, as a student, I'm really excited to be part of that and this experience too. So I thank you so much for sharing your time with us today. And I feel like I've learned a ton just from listening to you. So thank you so
It
much
was
for that. I appreciate that.
my pleasure. My pleasure. Thank you for having me.
Oh, thank you.